started with my presentation. So I had submitted to do two presentations. One was on the test-retest for the Brain Injury Vision Symptom Survey. And I'm going to forego that presentation and encourage you to look in the next COVD journal, because what I was presenting will be in optometry and vision rehabilitation. Basically, the bottom line from the publication is the survey, the BIV survey, has really good test-retest reliability, whether we're looking at a 2-week window or whether we're looking at a much longer window. So it's a really stable instrument, and it offers the possibility for us to look at, to expand our understanding of symptoms with brain-injured patients. So getting to this presentation, about 2 years ago, I was lecturing about TBI in Germany at our sister institution at the Allen University. And one of the master's students there, Katja Schibor, came up and she wanted to talk to me about fixation stability, because I had mentioned that with TBIs, one of the problems is there's an issue with the stability of fixation. And she asked a very simple, but I think really important question, and that was, can we improve fixation stability and accuracy by using a Heydinger's brush, an entopic phenomenon, and provide our patients, our TBI patients, with visual feedback to guide fixation to be more accurate and to be more stable over time? So I said, yeah, that's a really good question. We don't know that for sure, because we haven't used, at least I didn't know of anyone using Heydinger's brush with TBI patients. So lo and behold, a few months later, she showed up on my doorstep wanting to do research with TBIs in my VT service. And so to give you just a little bit of background on our study, wrong clicker, sorry. This is Patrick's clicker, which he was very nice to loan me. So we know that ocular motor skills are altered by traumatic brain injury. And traumatic brain injury also, as we know, changes that relationship between central information and peripheral information. So those who survive the brain injury are much less central. They're less focal overall, and they tend to be just more ambient after the brain injury. We also know that many critical oculomotor functions depend on that focal attention. To mention accommodation, pursuits, fixational eye movements, vergence, those are all dependent. And we also know that unsteady fixations have been reported to degrade eye-hand coordination, yield dysmetric saccades, and interfere with guided stepping and walking. So an important goal for us as rehabilitation specialists is to help the survivor gain better central focal function and direct their ocular motor system more accurately. So our assumption in starting this study was that there's probably a bidirectional relationship between focal function and between ocular motor function, meaning that if you treat one, you likely will see benefits in the other. So with TBI rehabilitation, how does the therapist really coax the patient to be more focal and less ambient? So we're not talking about when it should happen. We're just talking about how it should happen. So we know that what's fundamental to the therapy enterprise has been creating that kind of unique visual environment where the patient learns to sense these unconscious sensory visual ability and subskills. And from those training activities, they get feedback. And this feedback helps drive behavior change that's essential for the patient to be successful in vision rehabilitation. So traditionally, when we start with these types of patients, we want them more focal, we emphasize accommodative skills, eye movement skills to boost that central function. So the question that we were dealing with is, could we introduce monocular fixation feedback early in the VT therapy process and hasten this return to more and better focal function? And could patients use this feedback effectively to improve their stability and their accuracy of their monocular fixation? So the instrument that we chose was the MITT2, or the Macular Integrity Tester Trainer. And a shout out to Brunel Corporation. They were kind enough to loan us 5 of these units for our study. And recall that when you look into an MITT, if your foveas and ocular motor system are functioning well, what you see is this slowly rotating propeller that is stimulated, if you will, from the retina, and you have this polarizing effect that you see as shadows that are moving in a propeller-like function. So I'll just refer to this as the propeller in the future.